Good evening. Very warm welcome to you all to our annual Behaviour and Health Research Unit lecture. And before I introduce our distinguished speaker this evening, I just want to say a little bit about the Behaviour and Health Research Unit. I'm Teresa Marteau, I'm the director of the unit, and we're based here in Cambridge in the clinical school. And the main focus of our work is on generating evidence on effective ways of changing behaviour across populations to prevent disease and, importantly, to reduce health inequalities that arise from the social patterning of behaviour. And you can read more about us in the booklet that you would have picked up when you came in. And you'll notice that the lecture is organised together with CSAP, the Centre for Science and Policy. And while the group that I direct is focused on generating the evidence, the Centre for Science and Policy is involved in strengthening the links between research and policy. And both CSAP and the Behaviour and Health Research Unit have a particular interest in inequality, as do many of the scholars in Cambridge and increasingly outside of Cambridge. So inequality of income was ranked number one as a threat to world stability and order by the World Economic Forum in Davos at the beginning of this year. Inequality is big and it's growing. So in terms of size, 5 families in the UK have as much as the poorest 20% in the UK. Another figure in terms of growing, in the UK and elsewhere, the proportion of the share of national income earned by the top 1% has been growing significantly over the last 30 years. And inequality of income maps onto health inequalities. Just to give you a flavour of health inequalities at the moment, a boy born in Cambridgeshire this week has a life expectancy of 83, whereas a boy born in Blackpool this week has a life expectancy of just over 74 years, so a gap of 9 years. There is, of course, an historical context to this inequality that goes back beyond Beveridge and the formation of the modern welfare state, which is often where our politicians, with their historical myopia, think that history begins. And it's into this broader historical context and going beyond health that our lecture this evening is going to be addressing us. So I'm delighted to be able to introduce Simon Szreter, who is Professor of History and Public Policy here at the University of Cambridge and also a Fellow of St John's. Simon's the founding member of the History and Policy Network and managing editor of its electronic journal, History and Policy. And I should say that that network is linked with a centre at King's College in London. His main fields of research are demographic and social history, and the relationship between history, development, and contemporary public policy. To give you a flavour of his prolific output, I'm just going to read out the titles of 3 of his books, which could be on sale downstairs, but they're not. We haven't organised that. Fertility, Class and Gender in Britain, 1860 to 1940, Health and Wealth, Studies in History and Policy, and Sex Before the Sexual Revolution, Intimate Life in England, 1918 to 1963, and that was co-authored with Kate Fisher. In 2009, he was awarded the Arthur Wieseltier Prize by the American Public Health Association for distinguished contributions to the history of public health. Now, some of you might not know that as well as being a distinguished historian, Simon is also a budding behavioural scientist. And together with Danny Dorling in Oxford, he is setting up an experiment to change the behaviour of politicians by exposing them to child poverty. And it's been dubbed the Great Constituency Swap. And I think there's probably a very lucrative TV series in here. So it starts from the observation that there seems to be more variation between rather than within constituencies in child poverty. And so the conceit, if I'm correct here, is that for a week each year, MPs in different constituencies with different proportions of child poverty will swap with those where the rates differ. So, for example, George Osborne would, if he signs up to the experiment, spend a week in Sheffield Central, which has 31% of children living in impoverished households, compared to the 10% in his Tatton constituency. And the Prime Minister could swap privileged Witney, where there's 8% of child poverty, with Brent North, where there's 35% of child poverty. If there's time, we might be able to hear how that great swap is going. But for the moment, I'd like to invite you to address us, Simon, on the question of what can history tell us about current health inequalities. Simon Szreter.
Thank you very much, Teresa. It's a pleasure to be here and giving your annual lecture. This talk is going to cover some quite long-term history. As Teresa said, the main point of it is to infuse this debate on welfare today with a much longer-term perspective, which I think is missing. It's not going to be too much in the way of the statistics of health inequality in here, because I don't want to encourage David Spiegelhalter too much. So we're going to kind of this is probably amongst the few bits of obvious kinds of numbers that you might expect to see here. Of course, we are not surprised when Michael Marmot, when in his Social Determinants of Health report, told us that life expectancy in places, some countries like Botswana, was half of what it is in Japan. However, I think he did stir up a bit more surprise in pointing out that two districts 8 miles apart in the UK, Lenzie North in Glasgow, just outside Glasgow, and Carlton in northeast Glasgow, had such an enormous difference in life expectancy at that point in 2000. A boy in Lenzie North had an expectation of 82 years, and in Carlton of 54 years, about where the English national population was almost exactly 100 years earlier. This is associated with other forms, obviously, of inequality, and Teresa kindly mentioned this Prospect online piece that I did with Danny. I'm repeating there a couple of the statistics that she's already mentioned to you about the difference between Tatton, and the exact match with Tatton is in fact Glasgow Northwest, but Glasgow Northeast is the one that includes Carlton, so I put it in there, and you can see this extraordinary difference in the government official definition of children living in poverty. Under 10% in George Osborne's constituency, over 40% in Carlton, northeast Glasgow. We've already heard about Witney. Another point to note is that all 80 of the constituencies with the greatest child poverty in them, which is an eighth of constituencies in the country, all 80 of them have no Conservative MP representing this mass of poor children, although of course this is the government that is now going to determine their fates over the next 5 years at least. The argument about health inequalities from history, I think, is that health inequalities are, of course, ubiquitous. The key policy issues is how great are they, and they do vary enormously between different countries. They have varied enormously between over time. Question is, are they growing or are they narrowing? In the past, there were enormous differences in the chances of death itself, not so much life expectancy, but actually whether you were going to live at all at various crucial points. Early modern societies were afflicted with often harvest-related food shortages and dearth, which could be absolutely deadly. So this is the kind of most fundamental form of health inequalities which a long-term perspective is interested in addressing. Today, in high-income populations, we talk more in terms of social differentials in life expectancy. We expect most of the population to at least get to age 5, and then we're interested in how much further they progress in their lives. And that, I would say, is dependent on personal income or wealth to the extent that there is not adequate collective provision of universalist public services to maintain welfare, healthcare and social security. Obviously, it's a logical point that if societies do have extremely efficient universalist systems of this sort, we shouldn't see personal income and wealth actually having an influence over health chances. But in the absence of such systems, we do see these kinds of effects, and we certainly see them in England, as we pointed out, in England and Scotland and the UK. So I put it to you that health inequalities are a symptom. They are reflecting the health of our welfare state and our associated social security system. And to the extent that they're wide, they are telling us that that system is not delivering in an equitable universalist way for various reasons. Now, what about the main, in a sense, the single main message to get across from this lecture, which will not be news to early modern historians, but there are very few of those in this audience. Martin Daunton, probably one of the few, to whom this statement will be absolutely no news at all. But the principal kind of surprise of history is that the welfare state, the welfare system of England is not something invented after the Second World War by Beveridge. It has a full 400-year history in this country. The Elizabethan or Old Poor Law, sometimes called the Forgotten Poor Law before 1834, was a foundational institution in Britain's early economic success as an industrial nation. It existed. I think the reason why it's become forgotten is the 1834 New Poor Law completely changed the terms on which the nation's poor received support and assistance and created a deliberately deterrent system which went into folk memory very deeply as the enemy of the working class. Dickens' novels, which many of us are familiar with, have depicted the regimes of the workhouse, and that is the notion the poor law was a system that didn't do anything for the poor, was a kind of incarceratory apparatus. What is missing from that is the realization that for nearly a quarter of a millennium before the 1834 Poor Law, there was another poor law, the Elizabethan Poor Law, which operated on extremely different principles and was, for most of its long history, extremely good at protecting the poor, enhancing their health, protecting their welfare, and, in a sense, building the human capital of the population. Now, the provision of an effective and trusted collective social security system, both in its old and its new poor law forms and even today in the welfare state, always faces threats to its integrity because you need the consensus and trust of the population, both in terms of those who are paying into the system and in terms of those who are benefiting from it. And there can be free riders and cheating on both sides. Problems with the welfare state today are being addressed by the Conservative government primarily as issues of reducing costs, of it being too expensive, and of beneficiaries taking the mickey out of the system and needing to be reined in. I would argue that a historical perspective actually conduces to thinking that the free riding problem is certainly there, but actually it may be on the other side of the equation. It may be those paying in who are creating a much more a much bigger problem for the system at the moment, and so we are addressing the wrong end of the system in trying to fix it in this way. So let's just talk a little bit about what was the Elizabethan or the Old Poor Law. Two famous statutes of 1598 and 1601 for the relief of the poor. They were the culmination of about 60 years of experimentation, of trying to create a system of this sort, ever since the monarch had appointed themselves as the head of the church and had dissolved the alms-giving monasteries and other institutions. The Crown had realised that it had actually got a systematic problem on its hands about how to create a system for support of the poor, to try to avoid the obvious issues that early modern sovereigns were quite rightly scared of harvest failure and dearth producing sedition, unrest. Protest could be extremely dangerous for a monarch. So all monarchs are trying to work out, how do we deal with this system? The English system is extremely unusual in providing a universal legal right to relief for every subject of the Crown. Its universalism is also ubiquitous. It mandates that every one of the 10,000 parishes should establish a parish fund. Some of them already have vestigial parish funds. This Act says they have to create them. It is financed by a progressive local tax pro rata on land values of occupiers of land. So it's quite difficult to evade this tax. It is, the statutes say that this is to support the local poor all the year round, if necessary, not just in unusual times of dearth. And it also specifies it is to support orphans, the widows, the old, the disabled, and indeed the unemployed, if genuinely unemployed. This is a really comprehensive universal system, but it is 10,000 little mini welfare states, if you like, each one of them having on average 500 inhabitants in them. So its strengths are that it's got this highly devolved administration, which means that there is very high quality information in this system. It's quite difficult to cheat the poor law overseers. If you're going to pretend you're lame, you're going to have to keep this up all the time because you're in a fairly small community. But of course there are potential weaknesses also. Local corruption, overseers perhaps insisting on favours, perhaps sexual favours from widows, etc. There's the usual, human nature doesn't change. Although I think the system was an extraordinarily interesting and benevolent system, it doesn't mean that all the human working parts in it were full of the milk of human kindness. And that has often generated interesting legal documentation for historians, which enables us to see the system operating. It has the potential of free riding by parishes, certain parishes deliberately trying to get away with a very mean fund in the hope that poor people will actually go somewhere else and try to and apply to other parishes for their relief. And the converse problem of unlimited liability, of parishes worrying that people could come from everywhere to be a prey on their fund. So the system takes arguably 50 or 60 years to effectively solve many of these problems. It relies in part on a pre-existing institution, the justices of the peace, the magistrates, who exist in every parish in the country. They are locally resident and they are there to provide cheap, quick justice. And they hold their position at the pleasure of the Crown. They do not hold their position they're not in the pockets of the local elites, and they are monitored. Their exercise of justice is monitored by superior judges from time to time to ensure that their rulings are subject to appeal. The Privy Council, at that time a fairly vigorous and newish Department of Government, makes it its business to try to bear down on parishes that are attempting to not set a rate or to avoid doing so. And the use of the parish registers, which were established for completely different reasons in 1538, start to become quite useful to the poor law to settle without resort to expensive and transaction-heavy litigation claims about who belongs to which parish in order for their relief to be paid, because the laws of settlement, which are really fully finalised in the 1660s, set out a number of rules about where this absolute right inheres, and the rule is that it's in one place only. There are various rules, but probably the most important ones in a brief exposition like this are that the default is your parish of birth, but for a woman it's quite important because it shifts on marriage to the parish of your husband. So parish registers of both birth and marriage, of baptism and marriage, are quite important in enabling this system to avoid too much of a heavy weight of litigation between parishes disputing who is responsible for whom. And that litigation is itself quite valuable because it's generated a lot of the evidence that enables historians to be confident that that the system really did function and wasn't just a piece of paper signed by Elizabeth I. That that it's actually out there really working in all these parishes around the country. So by the poor law, the old poor law probably is in its really mature functioning form for nearly 2 centuries, between 1660 until it's repealed in 1834, and it consists of 4 interlocking institutions of local governance mandated by central government. The poor laws themselves, with their provisions and their legal entitlements, the justices of the peace, the settlement laws providing the rules of where your right inheres, and the parish registers. This set of 4 things functioning together allows this system to actually really function and so on. We have various other forms of evidence to triangulate to be more confident that this system really exists. I've mentioned litigation records. We have several different points in time when inquiries are made trying to work out the expenditure on the poor law, showing that, for instance, by the late 17th century, expenditure is running at approximately 1% of national income. By 100 years later, it's running at about 2% of national income. And then we have another kind of a source on the numbers actually drawing on poor relief a few years later during the Napoleonic Wars, confirming that a very large percentage of the population, 11%, are using the system in those years, which tallies with the idea of about 2% of national income being used on these transfer payments. And most of them are doles, outdoor relief as it's called, it's cash in hand to people. This is a scale of expenditure, 1% rising to 2% of national income, which is quite unlike anything else in the world at this time. There are other poor laws around the world, particularly in Western Europe, but they're not universal. They tend to be only existing in towns, not in every single parish. We also have some very important evidence, some kind of bottom line evidence on the capacity of this system to reduce health inequalities, those fundamental health inequalities of your chances of living or dying when the price of grain goes up, which it periodically does in the early modern era. The Cambridge group, who've pioneered the use of the demographic analysis of these parish registers in their 4% sample from this source, analysis of that material has found no evidence of either national or a regional scale famine crisis mortality in England after 1623, when that's the last time there was a serious famine in the northwest of the country. That is 150 years earlier than anywhere else in Western Europe. If we look at this sort of evidence in the rest of Western Europe, we continue to see correlations between years in which there are grain price spikes and mortality spikes. In England, uniquely, that correlation ceases to exist after 1623. And the best candidate for explaining why that should be so is the functioning of the poor law at that scale of operation of 1 to 2% of income being transferred to the poor when necessary. So this is a unique English institution. a very important article, Peter Solar's article in the Economic History Review in 1995, I think first really, and it took a kind of non-British historian to come along and look at the British system and say, this is actually really unusual. Although poor laws exist everywhere else in Europe, they're only there in the cities. The big problem is when there is dearth, when there is shortage of food, the rural poor come straggling in towards the towns where they feel they've got a chance of some alms and support. They often bring disease with them, and of course the biggest killer during famine periods is typically disease. The English system obviates that because there's no need for the poor to move. They are going to get relief in their parish from the parish fund. The price of grain goes up, they get money in their pockets to continue to purchase grain, keeping the market working as well. These couple of other, I think, very important works. Steve Hindle's book on the parish is probably the best recent book looking in detail at the working of the poor law in this period in all sorts of ways, using a lot of those litigation records. Laurie Charlesworth's book is important as a legal historian. She's the one who recently emphasised that there really is an absolute entitlement to relief in law, that entitlement wasn't a convention, it wasn't a custom, it's actually a legal right in England. Something that's often been argued about systems like this is that, well, if you have a kind of generous, collectively provided system, surely this is going to crowd out civil society, volunteering, philanthropy. These people are going to say, well, I've paid my rates, the poor are now sorted, I can just get on and do my own thing. I don't have to volunteer, I don't have to think about the poor anymore. To the contrary, according to Abraham de Swan, he points out that comparing this new English system of requiring the parish to levy an adequate poor rate compared to the pre-existing system in England, which was more reliant on wealthy individuals' sense of charity and mercy, that this religious obligation actually creates a very different kind of framework which can, in the right circumstances, enhance, not decrease civic activity. And those right circumstances were very interestingly provided by Elizabeth I, because in the very same year of the second of those acts for the poor relief, she passed the Charitable Uses Act of 1601, which is the foundation of all charitable law in this country for the next 400 years. It wasn't really seriously revised until only 20 or 30 years ago. What's really interesting, if you read the Charitable Uses Act, is its definition of what are the purposes of charitable activity in England. And they are exactly the same as the poor law. There's only one significant exception, which is education. But all the other things that the poor law is supposed to do are the things that are recognised as appropriate for charitable activity. So I think this is really interesting and a really intriguing piece of statecraft. What the Crown is setting up is a very important incentive structure for the wealthy and the elites in society, and indeed for the middling sorts. What it's saying is you have to support the poor in your community. Whether you like it or not, you're going to have a parish fund, you've got to pay into it. If, on the other hand, you decide to use your intelligence, your resources, your connections to set up forms of institution like schools for poor scholars, almshouses for the elderly, apprenticeships for orphans, etc., which are actually effective in dealing with the lives of the poor, in giving them a leg up, in enabling them to get on, then it's quite likely, this isn't said in the Act, but it's quite likely that over the longer term your poor relief bill is going to fall. Because if you can support the poor effectively in these ways, they're not going to be such a big long-term drag on your resources. Also, of course, you get the enormous benefit of kudos in the local community for your family. It's impossible to walk into a church today or around a churchyard without seeing these plaques on the wall, mostly from the 17th and early 18th century, to the families who have set up funds for the poor, built houses for the poor, even schools for orphans. This very clever incentive system actually coming into operation, and therefore crowding in, not crowding out, civic society and philanthropy and activity. It's also the case that it encourages the elite to use their intelligence to actually use the very flexible poor law to do things for the poor as well. The poor law is the origin of free hospitals. It's houses of industry in cities which begin to open infirmaries for the poor, because they, of course, discover that a lot of the reasons that the poor are poor and needing support is they're ill. And they realise when they're in towns, they have a sufficient flow of the ill, that they start to find it's necessary to have an infirmary in their house of industry and to employ a doctor. So there's a number of ways in which this system starts to generate a wide-ranging welfare, social security type system. Now, what's also very, very interesting is the way in which the functioning and the burgeoning and the intensification of this system correlates so well with England's economic rise to strength and prosperity. Economic historians like, if they can, to produce measures of national income. It's very, very difficult to do that for early modern period, and there have been some recent attempts to do so. I still prefer the much more robust measure, which is the proportion of the population living in urban places. This, I believe, is a far more robust and valid measure of the extent to which an early modern economy is becoming more commercialized, more developed, achieving higher per capita income. By definition, the greater the proportion of its population it can support off the land in towns and cities, the higher the productivity of the agrarian sector must be, and also, of course, the more manufactures and services are going on in this economy. What we can see here is that the Netherlands was the outright leader of Europe throughout the early modern period. Indeed, for the world, it already had nearly 30% of its population urban as early as 1600. Absolutely, completely ahead of any other place on the planet. The picture for France mimics most of the rest of Western Europe, staying at about 9 to 10% through the 17th and 18th centuries. And of course, the one that your eye is drawn to is the line for England, which shows a very extraordinary, unusual performance across these 2 centuries. Its economy is actually rising to catch and eventually overhaul the world leader of the Netherlands. So this is the period in which the poor law is providing this ontological security for the population, freedom from famine, fear, and security in old age, allowing the younger generation to leave and move to the cities without the elder generation living in fear of what's going to happen to them in old age, because there is a parish fund to support them. And I think that I'm certainly not I'm not trying to argue that the poor law is the primary cause of the Industrial Revolution. Of course, there are many, many other causes involved, but I think it was an important facilitating institution that has probably not been sufficiently given its due. I just really want to look at this line at the bottom, the dotted line, for expectation of life at birth in England. This is the expectation of life at birth across the period of the functioning of the poor law. It's rising gradually, unevenly, but gradually rising from somewhere like the early to mid-30s to a level of about 40-ish approximately. It then stalls for about 5 or 6 decades. It is rather unusual, this period here, although it doesn't look like much on the graph. It's odd that the expectation of life at birth in the nation actually fails to improve at exactly the point from about 1820 through to 1870, half a century, when England's economy was booming like never before. It was winning the world's trade. Fortunes were being made in Manchester and Liverpool, but they're not translating into increased health of the population. And in fact, work I've done with Graham Mooney has shown that in the in the centres of industry where all the wealth is being created, like Birmingham, Manchester, Liverpool, Glasgow, Leeds, actually life expectancy is really struggling in this period. It's as low as the mid-20s in the centres of those cities in this period. So there's something going badly wrong. And one of the contributors to what's going badly wrong is the new Poor Law, brought in 1834, which slashes in half that figure of about 2% of national product being delivered in transfer payments to the poor, is deliberately slashed in half over a 2-year period to back to 1%, and it's held down at that low rate all the way through the rest of the century. I don't think that can possibly have helped the population in this period of stress when these cities are growing so fast and overcrowding is so great. However, what we can also see from this graph is something starts to change in the Edwardian period. This is when old age pensions are first introduced, and we can see that the story of pensions never goes back again. Throughout the 20th century, pension spending has gone up and up and up. Spending on other forms of social security rose during the interwar period. In fact, it rose in advance of Beveridge's welfare state. There was partly because of the enormous amounts of unemployment. There was a need for greater spending, but that also has that component of spending has also risen in the 20th century. Of course, then we get to the welfare state that we're more familiar with, the post-1945 one. Of course, there are new important principles here. It is centrally funded through progressive national taxation. Its advantages of this system are uniform national health service, associated national services, promoting human capital, health, social security and welfare of all. This enables the national average life expectancy and the quality of life above age 65 to be driven up along with human capital all through the last 50 or 60 years. And there's some figures there that show that in the 1930s, life expectancy was around 60 for males and females, but by 2010 it had risen to 78. 1938, we often forget, only 6.6% of 15 to 18-year-olds were even in secondary school. It's incredible underinvestment in the nation's human capital. 6.6% in secondary school, 1% only in universities. By 2014, we have 100% in education at age 16, and we have 40% in university at age 19. Enormous uplift in the investment in human capital in the population. 1939, 2.7% of GDP spent on education, risen to 6.4% by 2010, but the theme of the last 5 years, of course, now projected to be flat, and this is an extraordinary cut, a 50% cut in the extent of the nation's expenditure supposed to be spent on education. I mean, this is the economics of the madhouse, I would say, because investment in human capital is the future of growth for the economy. The costs of human success. History shows that to enjoy all the benefits of... We now, after this 400 years, we now live in a society in which we expect as a right to live very long, healthy lives in a stable, prosperous society where life and property is secure. That is very expensive to achieve. It costs a lot of our GDP to enable the entire population to have that standard of life. It absorbs about 40% of the GDP of the country. This is true for almost all economies in the advanced economies. A few, like the USA, are slightly below that figure, and a few, like Sweden, are slightly above. But it's about 40% is what it costs to do that. But on the other hand, what else is there to spend all this enhanced wealth on? It's no good having lots of extra cars if you're not living healthily and a long life. So this is England's. This is the whole 20th century. government expenditure and government revenue, tracking each other, of course, except for the two world wars, and rising to this 40% level by the mid-1970s, since which it has more or less stayed at that level. I find it extremely worrying that the government entertains ambitions of reducing this to 35%. It can only be done with, I think, extremely foolhardy cuts to our overall investment in our society. Beneficiaries of the welfare system, this is official statistics. We currently spend 205 billion, or we did last year, on benefits, and of course the enormous big category there is pensions. 44% of it is pensions. Various other things that most people agree are very important: child benefit, sick and disabled, low income support. Often a lot of that is in housing, unfortunately. And of course the thing that I wanted to particularly draw your attention to is benefit fraud, which is an absolutely tiny fraction of what's going on here. It's way below even benefit error. It's not much more than half of benefit error, which is the government's own official mistakes in what they're doing. So benefit fraud, this great bogeyman of the Daily Mail and the Express, is statistically close to insignificant. However, very interestingly, a YouGov survey published by Peter Kellner in Prospect magazine found that the YouGov found that the public believe that 22% of government welfare budget is fraudulently claimed. That would be equivalent to £40 billion. The public seems to have a completely unreal perception of this problem, which of course licenses the idea that we should be concentrating on cutting this extravagant form of public expenditure. However, 40 billion is close. It's nothing. It's a fantasy if it's in terms of fraud, but it is quite close to the official tax cap estimate of tax evasion and avoidance. The official estimate is actually 34 billion, but of course we all know that the official estimate is very, very imperfect. As a result of which, the Institute of Fiscal Studies, in its report "Tax by Design," argued that a general anti-avoidance rule or principle needed to be brought in to try to police tax avoidance even more stringently. That's exactly what happened in 2013. There was a GAAR brought in. However, when one looks in the detail, it is a non-deterrent system. There is no disincentive in it to continue to try to avoid. Of course, evasion is illegal, but to avoid as hard as you can, because you only have to pay back there's no penalty attached to it. And various other reporters have found that this particular version of the GAAR is not going to touch the most important avoidance schemes. Thank you. Yeah, that's fine. I think the two most important books I've come across, if you want to know something in detail about this extraordinary, and I hope I can persuade you, extremely important problem for our welfare system, is Treasure Islands by Nicholas Jackson, a Financial Times journalist who I think produced this extraordinary, perhaps the most frightening book I've read in the last 5 years. Very brave book in which he did a lot of very important research on the setup of how tax havens work and how the City of London is the spider at the centre of the web of all this, the corporation of the City of London. And the book on tax havens, How Globalisation Really Works, by Ronan Palin, Richard Murphy and Christian Chavagot, is also a set of chapters which I think are extremely informative on the international history of an operation of tax havens, which until very recently was something very, very hard to find out very much high quality information on. What is the true side? This was described as an iceberg by the Public Accounts Committee. What is the true size of the iceberg of tax avoidance and evasion? Richard Murphy has done these two studies, the tax gap in 2014 and another study called In the Shade, supported by Oxfam and Roundtree, also in 2014. His estimate is that after taking away the 18.2 billion of irrecoverable tax debt, which the government also recognises, his best estimate of the size, the true tax gap, is £101.2 billion. He also goes into detail about why his estimate is different from the HMRC estimate. So if you want to read in detail, you can see how he goes through this. Probably the single biggest item of difference is trading in the shadow economy, where it's simply the case that HMRC acknowledges that if accounts are not filed and not put in, then they don't study them and they don't count them. Whereas Murphy and his associates have made efforts to study those non-filed accounts, and they find that, as one might expect, as we know from hearsay from the Amazon and so on, and many other big corporations, the volume of net sales in the UK that don't pay VAT is colossal. So there's an enormous amount of this evasion and avoidance going on. £101 billion, well, how much is that? That's about half, as we saw, of the total benefits bill. It's also about 1/6 of public sector current expenditure. So if we think we've got an austerity problem and we need to cut and cut and cut, if we could get some serious action on tax avoidance and evasion, we'd be in a rather different world in those terms. The Conservative plans for welfare over the next 5 years are that 12 billion per annum in further cuts, that's after the 21 billion we've already seen, are to be achieved by 2020, in the context of a public opinion which fallaciously believes benefit fraud is over 3 times that level. So that's why politically and electorally, I guess you can make these arguments, is if the YouGov poll is right, this doesn't look so mad to the general population. There is, in fact, the reality is there is no scope to find cuts of this sort from fraud, from error, or from unemployment benefits, or from the triple-locked pensions in an ageing population. That 12 billion must come from child support, from cuts to the sick and the disabled, or from cuts to low-income families, exactly the groups which the Resolution Foundation and food banks already indicate have been suffering quite severely as a result of the last 5 years of cuts. The Conservative manifesto on tax avoidance promises 5 billion of reduction in tax avoidance, and certainly the latest announcement from Amazon is helpful. But more worrying, I think, is when one looks at what the plans are for HMRC staff, which did number 92,000 in 2005 and have already been cut back to 62,000, and the plan is that they're going to be down to 50,000 by 2016. The chances of them actually recovering and working on some of that 100 billion beyond this rather modest target of 5 billion are, I think, not very promising. Rising wealth inequality. Meanwhile, the 1%, Thomas Piketty's Capital in the 21st Century, has revealed that contrary to the long-believed Kuznets curve, there is an inherent tendency for returns to international finance capital to increase above the rate of return to national labour forces or to real economies, the famous R is greater than G equation, which is on T-shirts in New England apparently. This tendency, he says, is visible. He has data, long-term data, 1790 to 2014. It's visible. The tendency is there and visible in his data, except for one period, 1910 to 70, period of increased and high progressive taxation. It's therefore all the more important to citizens to pressure their democratically elected governments to lean firmly against this tendency in the global market economy. Citizens need to be voting for a return to progressive taxation on income, capital and especially financial instruments. And they need to be pressing for elimination of the secrecy jurisdictions, another word for the tax havens, which enables both tax evasion and world corruption, as we've seen with the FIFA scandal, to proliferate. Such equitable fiscal redress is necessary also to provide the required funding in ageing democracies for national welfare, health and social security systems to minimise health inequalities. Otherwise, we're just going to see the health inequalities increase. So, to conclude, the policy conclusions from history, I would submit, are that maximising the development and healthiness of all human capital in society is a key to long-run economic productivity. A universalist welfare state and education provision, progressively funded, has been throughout most of our history and is the most effective and just institution to achieve this. Health inequalities are the canary in the mine telling us if this is functioning well or not. Cutting the welfare state and vital public services like education in the name of austerity is not a long-term economic plan for national productivity, nor is it a solution to the causes of the financial crash of 2008, and it will only exacerbate and increase health inequalities. So a rational, historically informed and fair public policy for 2015 to 20 would be, firstly, measures to prevent a return to excessive risk-taking in the global financial sector, and the UK government does have a leading responsibility here because the city is located within its jurisdiction and because of the UK's many tax haven dependencies. Secondly, a return to the progressive and just taxation principles which we saw across much of the 20th century and which are necessary to neutralise the Piketty tendency and to fund pro-growth welfare and human capital productivity. This, I would submit, is the only thing that's going to act to minimise both child poverty and health inequalities. Thank you.